have in the United States of America the greatest health care system in the history of the world.
There are at least a dozen countries with lower rates of preventable mortality than the United States, and not one of those countries spends 60% of what we do on health care.
We're now treating medicine as if it were an industrial product. Throughput. How many units of care can you deliver? The idea that you're going to see a patient on average for between 12 and 15 minutes, no matter what their condition.
We put forward a plan that makes sure that it is affordable to get health care that is as good as the health care that I have as a member of Congress.
The film came about because I had read Maggie's book, Bull, about the bull market of the late part of the 20th century. I was floored by it. And then read Money Driven Medicine. And Rob Johnson, one of the executive producers, and I were floored by it. We thought, we've got to make a movie about this. This is tremendous. So we turned to Maggie. One of the things that intrigued me about what Maggie had done is that Maggie, in a way, was like a detective. And she went and talked to doctors. And the interesting thing about this whole process is that doctors were telling Maggie that the system was broken, that they wanted to provide a different kind of health care than they were able to under the current system. So everybody talks about how, we don't want to get the government in between the doctor and the patient. The fact was the doctors were frustrated because the current system doesn't allow them to do the kind of work that they want to do.
I think it could have an influence on the debate in Congress right now, but I also think that no one's planning on rolling out healthcare reform until 2013. So for the next 3 years and 3 months, we are going to be fleshing out the details of what healthcare reform will mean. That means intense further debate about all sorts of things, including how we use comparative effectiveness research, how we change the way we pay providers, how we change the way they deliver care, so it can be more collaborative and more patient-centered. So I think that the film is going to be part of, I hope, that ongoing debate for more than 3 years.
It's really a film about doctors and their frustration with the system. And we always talk about that relationship between the doctor and the patient. And this is a film that asks the doctors, what's wrong and how can we make it better? And everybody talks about this thing in terms of the new healthcare debate from a policymaker standpoint. Well, what about the doctor and what about the patient? Everybody uses them rhetorically, but I think this film can be extraordinarily valuable because it talks to the doctors and indeed some of the patients.
More care is not necessarily better care. And about a third of our healthcare dollars are wasted on unnecessary, ineffective, sometimes redundant, often unproven, sometimes unwanted tests, treatments, hospitalizations, drugs, and devices. And that's not just a waste of money. The problem is whenever a patient is exposed to a treatment that he doesn't need or that is ineffective, he is exposed to risk without benefit.
On October 27th, I believe, there will be a screening at the Capitol. And that's going to kick off a watch-in. Now, we remember the be-in, we remember all sorts of other things from the 60s. This is all about trying to stream it live, on a website all over the country, and to get people motivated to look at this film and to use it as a tool to understand some things that they really didn't know were broken about the system.